And now I'm talking to Breda Gahan from Concern Worldwide. Breda, how's it going?
Hi Darren, thanks very much for coming in to Concern and for marking World AIDS Day 2017. I can't believe this day has come around so quickly, and it is important people understand the seriousness of the situation both globally and even here in Ireland.
Breda, I've interviewed you a few times already. I think everyone knows what AIDS is. Can you tell me how and why World AIDS Day came into existence, and can you tell me how the day is celebrated in Ireland and around the world?
Yeah, World AIDS Day was the first ever actual World Health Organization Health Day, created in 1988, so 30 years next year, to support people to unite in the response to HIV and AIDS, and particularly to show solidarity to those who were all dying then, living with HIV, and people directly affected. It started especially in the USA. A lot of young gay men were dying of this unexplained illness. Even in Ireland, up in St. James's Hospital where I used to work, nobody could understand what was going on. So the day was created to support people living with HIV, like I say, people dying of AIDS, health workers providing care and support. Sadly, we didn't have a cure, and to mobilise international and local resources to respond to the epidemic.
I've interviewed you a few times, so we don't have to go through everything to the same extent again today. I watched a video recently on YouTube that was posted on the last World AIDS Day 2016, and the first sentence of the video says, because people are not dying of AIDS anymore, most people think that AIDS is not relevant to their lives. What would you say to that?
Well, I guess it very much depends on where you're living, your geography and happenstance of birth. If I was born with or living with HIV in Ireland, I've access to free treatment for life. Would help me to stay alive. People like Robbie Lawler, Panty, Rory O'Neill, have spoken out about living positively with HIV. It's part of living as you would with maybe diabetes or some other chronic illness. Unfortunately, in poorest countries, this is not the situation. And over 17 million people still living with HIV do not have access to treatment. That's almost half of the people living with HIV globally. 1 million people died of HIV and AIDS-related illnesses in 2016. And there were almost 2 million new infections. So the rate of new infection is still outsmarting us in terms of response. Children particularly are especially being left behind. It's difficult to access and to make the paediatric formulations and the syrups that children need to take to stay alive and stay healthy. 43% of children are being left behind not on treatment globally today. This is a shocking indictment of our global world health system to say that children can be allowed to die when treatment does exist.
Yeah. If you have HIV and you're not on treatment, it takes several years to progress to getting full-blown AIDS. Bearing in mind the time factor, how can it be that 1 million people are still dying of AIDS every year?
The main drivers continue to be extreme poverty, stigma, discrimination, injustice in terms of lack of access to testing, treatment, care and support services. The silence and stigma has actually increased, I would say, in the last decade as more and more middle-class people in countries seriously affected in Eastern, Central and Southern Africa realise their right to access treatment, know people in the Ministry of Health or health services that can provide them the treatment. It's the disadvantaged, marginalised, migrant, prisoner, intravenous drug user, sex worker population that are being left behind and denied access to the services that can help them to stay alive if they could access treatment.
I saw a few videos on YouTube of wards and hospitals in Africa. They're going back a few years now, but they're pretty much death wards. People are dying of AIDS on the wards, and there was no cure at the time. Are there still wards in some hospitals in sub-Saharan Africa where people are dying of AIDS due to a lack of funding, or is the era of AIDS death wards actually over?
Sadly not. Certainly, and especially in poorest countries in Africa and in Asia. I was in South Africa at the Durban AIDS Conference in 2016. I visited the Hillcrest AIDS Centre Trust, hacked, They have a respite unit with 24 beds that's full and people waiting to enter all the time. Often it isn't just the lack of access to treatment. Even with access to treatment, people lack food to stay healthy. Food, I would say, is the first medicine. And in countries where you've situations of famine, hunger, lack of access to good quality food, it affects people's outcomes in terms of living positively with HIV. Thankfully, there are less hospices, but they do still exist in poorest countries where, for some, the burden of taking the medication without support, without adequate food is too much, and people need the support and die in hospices. Many have been supported by Irish missionary organisations, supported by Irish Aid in the past. Medical Missionaries of Mary Concerned worked with in Uganda. And sadly, as the missionary organisations are losing numbers, the response and the needs are underserved in terms of supporting the poorest who aren't living positively and who are sadly dying still of AIDS. 1 million, as UNAIDS reported in 2016.
If you have HIV and you're not and you're not taking your medication, or you haven't got access to it, and then you get really sick, but you haven't got full blown AIDS, but you get really sick, and you go to a hospital, is the service there? You know what I mean? Like,
it depends on which hospital you go to. Again, it's a question of geography, happenstance of birth. I was recently in Sudan, West Darfur. There are small numbers, but people there living with HIV, afraid to tell anybody, extremely secretive. Access to treatment there is extremely difficult. People talk, confidentiality is broken. Likewise, I've recently returned last week from Bangladesh. Extremely difficult, again, for poor people to access treatment, and sometimes healthcare providers don't protect people's confidentiality. People are afraid to be seen with the medication in their hands. It's an ongoing situation of stigma and self-stigma for people living with HIV, who then feel they're not good enough. And I didn't mention earlier the whole issue of inequality in terms of social, economic, and particularly gender. Women particularly are often blamed for transmitting the infection, because often women are diagnosed during pregnancy. Generally, every pregnant woman wants a healthy child. But if you're living in Africa or Asia in a poor situation, once you're found out to be positive, many women have told me their husbands or partners walk out the door, even though it might have been the partner that infected them, because their status is known more quickly. Very few women refuse to have the test, knowing now, thankfully, one of the successes of the global response to HIV has been reducing mother-to-child transmission. PMTCT, prevention of mother-to-child transmission, which was first initiated actually in Ireland, in the Coombe and other maternity hospitals in the early days. People in other countries, mothers were advised to terminate pregnancies if they were pregnant living with HIV. That situation still isn't possible in Ireland. So we were seeing babies born. We thought they would all be positive. Thankfully, not all were, approximately 30%, because the baby can become infected during pregnancy, labour, delivery, and unfortunately through breastfeeding. Again, this is a big dilemma for mothers who want to do best for their babies in countries in East, Central and Southern Africa where Concern is working. And we're integrating the response within our healthcare programs. It's great to see this year UNAIDS theme is My Health, My Right. And I do agree, although we feel the spotlight on HIV is, off topic right now in terms of other issues, it is better integrated into education, livelihood, food security and health programs. People living with HIV, families affected by HIV, have ordinary lives the same as anybody else. They want their kids to go to school, they want to have some sort of income, earning capacity through farming or whatever, and they want to be able to access routine healthcare. So integrating it really is important. And Irish Aid has been doing great work in their partner countries in Mozambique, Tanzania, Uganda, Ethiopia, Sierra Leone. Spending now increasingly funding on integrated health and HIV responses totaling €80 million annually. I was at the Father Michael Kelly lecture focusing on young people and HIV, adolescents, last Tuesday. And Father Michael, who lives in Zambia, great educator, has always argued that, education is the social vaccine. Get girls in school, get boys in school, keep them in school. Knowledge is the first defence. A young person needs to understand how HIV is transmitted, how it's not transmitted, and how they can protect themselves.
Yeah, the video I told you about there a few minutes ago, about the first sentence was the people are not dying of AIDS anymore. It was made, maybe surprisingly, by PEPFAR, and PEPFAR, they're American, and they're, I believe, the biggest funder of antiretroviral drugs in the world. Can you just tell us who are PEPFAR and a bit about what you know of them?
Yes, PEPFAR, it's hard to imagine, but PEPFAR started in 1998 under the Bush administration, when George Bush was elected president at the time, working with Condoleezza Rice, focusing on Africa. And PEPFAR stands for the President's Emergency Plan for AIDS Relief, PEPFAR. So it's US government funds, currently funding antiretroviral medication for 11.5 million people living with HIV globally. It's one of the key actors with the Global Fund supporting treatment access to people living with HIV once they've been tested. Unfortunately, with the current administration, again, funding for health and HIV response has been falling, and with the currency fluctuations. So it is a major concern that the money needed to treat the people living with HIV going forward may not be sufficient. Like I said, 17 million people globally are still not accessing the treatment they need to stay alive. 7 major donors, including Ireland, are, at the front of the response: Australia, Norway, France, Germany, Italy, Japan and Canada. And really, these donors are leading by example. In Ireland, like I said, we have up to 10 new infections diagnosed every week. It's treatment for life. So it is a burden on the health budget. If money is spent on the HIV response, it's not spent on maybe some new cancer treatment. Every country has a limited, finite fund, even though I do believe more countries could spend more and invest it more wisely in health. Health is wealth. We learned with Ebola, the situation in Sierra Leone and Liberia, what an epidemic outbreak can do to a country. Because HIV and AIDS is a slower onset and it's not seen, people generally think, oh, he or she died of malaria or cancer or TB. It's often unrecognised and not put on the death cert if a death cert is issued. So people do understand it's not transmitted in the same way now, at least a lot of people, not like an airborne disease. But there's still a lot of misunderstanding and myths and misconceptions. Many young people do not have accurate knowledge in terms of how to protect themselves and how, especially, it's not transmitted by shaking hands, kissing, sharing food with people. There is still a fear out there. When I was living and working in Mozambique with Concern, a country with 60 different languages, rural people told me many times they didn't know what to believe. The traditional healer said one thing, the government was saying something else, religious leaders were saying something else, international organisations like Concern were saying something else, peer groups in school were saying something. Really, there's a lot of misunderstanding, lack of accurate knowledge. Myths and misconceptions persist. And really, we need to support what's called a peer education support, so that people can hear information from somebody in their own language that they can trust, believe in and act upon. And that's not always possible in remote areas in Africa or Asia, and in urban slum areas, again, where people lack access to basic education and health rights. I've just come back from an urban program we're supporting with the urban slum dwellers, squatters and pavement dwellers in Dhaka, Chittagong and Mymensingh. and we did a study there with people to find out their knowledge, and it was appallingly low. They're so busy staying alive day to day, they're not, I can understand, too worried about a virus that might infect them today that might make them sick in 5 years' time.
How long does it take if you're not on treatment to get full-blown AIDS? Do you know?
In the past, I could see up in St. James's Hospital, where I was working on the top of one, you know, it's different for everybody, but if people can eat, they stay alive longer, and it depends on the quality of food. At that time, I do remember people had great difficulty eating, diagnosed late with oral thrush. So if we could treat the opportunistic infections, we help people to stay alive. I say the same in Africa and Asia on my trips. Even if antiretrovirals are not available immediately, do the best we can with especially supporting people to have access to better food, clean water, healthy environment. You know, we in Ireland are not exposed to the same environmental and infection threats as a poor person in Africa or Asia. Clean water to wash your hands, you know. So it really does depend. And everybody's immune system is different. How much viral load they have, how strong the CD4 count is. It's like treating a person's cancer. Everybody has to be assessed individually and treated individually according to their particular situation. Some drugs work better for one individual compared to another.
Yeah, so if you're undernourished, say you're living in sub-Saharan Africa and you haven't got much food to get by, like, is there any kind of average length of time where it'll take if you're not on treatment to get AIDS? Like, it'll presumably be a lot faster. You get it than in Ireland, like. Absolutely,
that's been our experience. Anybody with concern will say, "Gosh, that person seemed to be okay, and they died suddenly." You know, I've seen in the days in Zambia before treatment, people wheeled in wheelbarrows. They stay at home until they're not able to walk. And then late diagnosis, you know, it's really hard to come back. Even in Ireland, people are diagnosing late. You know, early diagnosis puts you on the road to treatment. And in Africa, we call it the HH factor in terms of the hunger, HIV, interrelated circle. You know, hungry mothers will do anything to feed their children. I remember women in Mozambique who would have sex with the drivers to get their food to market free of cost. Knowing these people, it wasn't rape. They had informal relationships just to get the food to market so that they could earn more money from selling the produce. The same with the fishermen and fisherwomen in Uganda. A lot of infection happens when people take risks to get greater income into their poor household, and especially to feed their children. And if your food, like you say, consumption is not good, not high quality, you're more likely to develop AIDS and other infections like TB, malaria, skin infections, pneumonia.
So say if you're in Ireland and you have HIV and you're not on treatment, you can expect to live for probably several years without getting AIDS. But if you're undernourished, living in a poor country and you haven't got much food, like you might live for 3 years or something. Is that be a right figure?
That's about right. That's about right. In Ireland, you could live for 7-8 years, but if you haven't been tested and don't know your diagnosis, you could be inadvertently passing the virus to somebody else. In terms of HIV, like I said, the theme this year is my health, my right, but we also have responsibilities. To me, HIV testing should be as routine as an annual dental checkup or a sexually transmitted infection checkup, a heart checkup. You know, it should be routine for everybody so that we protect ourselves and protect the people that we might infect inadvertently. Because there's no going back. Until now, we still do not have a cure. We can treat the virus, but we can't cure AIDS. We can't cure HIV. Well, I think it's important that you're marking World AIDS Day, Darren, and in Bangladesh and in many countries, I know it's coming up in the next question, but the media has a huge role to play. And I believe, I need to go and find it, I believe Time magazine this week has 5 or 7 stories. It's the front cover.
I saw that. I think that was an old article.
Oh, was it?
Yeah.
It was on Twitter yesterday.
Oh, sorry,
So I must go out and check. But the media and social media, and particularly to reach young people through Facebook and Twitter and blogs, media has a huge role to play. Responsible media, reporting the facts, not being sensationalist, helping people who are living with HIV and affected by HIV, as at the Father Michael Kelly lecture supported by Irish Aid and the Irish Forum for Global Health last Tuesday, I think it was. Yeah, Tuesday, to speak out. People who are, so far I'm not living with HIV. My last test was negative because I work with people who are positive, and often, it's important that people who are up close and personal to the issue talk about it, and people who are supporting people who are affected.
Today, the 1st of December, is World AIDS Day itself. Can you tell me how else are you spending the day? And can you tell our listeners, you just mentioned about one thing, but can you tell our listeners how they can best keep up with developments with HIV internationally, and how else we can get involved in the fight to end AIDS?
Yeah, well, the best thing is, I often say it's World AIDS Day every day for the 36.7 million people living with HIV today. It's AIDS Day every day for them, and at least 10 people directly affected. If I'm living with HIV, probably a mother, a father, a brother, a sister, a cousin, a health worker, a work colleague, at least 10 people are directly affected. And often they're missing in the response. They worry. Often they need counselling, even more than the person living with the virus. So it's really important we inform ourselves. I have a blog posted today on the Concern website. People can look in there. UNAIDS is the best website in terms of supporting the global response with accurate data, accurate information, important publications on education and educating others. There's another website from the UK called Avert, again updated almost weekly. It's really important people keep informed and think that's got nothing to do with me. Anybody who lives their lives in terms of having sex, taking drugs, whether legal or illegal, people in prison, migrants, HIV can affect every individual and every family. Everybody can become infected. It's how we live our lives, and it's really important we help ourselves and help other people, and especially young people, adolescents, children, to reduce their risk and vulnerability. In many of the countries where Concern is working, it's summer, unlike a freezing cold day here in Dublin. So people love to get out with the Ministry of Health, with all our local partners. It really is a day of feet on the street with red ribbons, with banners saying stop AIDS now, go for testing, know your status, stay on treatment if you're HIV positive. So it really is marked in terms of solidarity, celebration in a way, although we shouldn't be celebrating that people are getting infected still at the rate they are. 5,000 every day is far too many people getting infected every day. But it is great that people still feel mobilised to get out on the street and be supported by government and local NGOs, including Concern and others, on World AIDS Day, from Afghanistan to Liberia to Zambia to Mozambique, Bangladesh, India. Twitter and Facebook will be full of blogs and people making statements today. And increasingly it's good to see that Ireland is marking, we have Irish AIDS Day on the 15th of June and World AIDS Day today, the 1st of December. In fact, our President Higgins, is marking the event tonight at Áras an Uachtaráin. I've been invited. I'm happy to participate. He's acknowledging and supporting people who have been supporting the response locally and globally over the last 3 decades. I'll be joining with my colleagues in the DOCA's HIV and AIDS Working Group, with the Irish Forum for Global Health, and with HIV Services Ireland. That's a great website in this country for anybody who wants to find out where they might get testing, which organisations exist in Dublin, Cork, Limerick, Galway, Northern Ireland, so that they can inform themselves. Often people want to have their test outside their home area. So HIV Services Ireland is an important website, and they've issued a press release today. So thanks to everybody who's listening. I hope if you're not carrying the HIV virus today, you stay HIV virus free and help us to support those who are living with HIV to live positively so that we can reach the Sustainable Development Goal 3 to end the AIDS epidemic by 2030. It's not that far away.
Yeah.
Thank you for your interest. Thanks, Darren.